mention to you about COVID and other things related to health. You will receive for participating gift card. It can be either gas card or Winco card. Camellia has those for you. But it's just a way for us to make sure that you have the information you need. And are more knowledgeable about stuff. COVID does take lives, right? My dad lost his life due to COVID. He was, active man. He wasn't ill, but it took people's lives. Whole families were wiped out. They didn't isolate and things like that. A lot has changed, right? COVID's changed. A lot of the population is vaccinated and things like that. So they'll share more about that with you. And so I don't want to, speak too much, but there will be an opportunity for you to ask questions of the panel and provide feedback later to me, if this was valuable, and even let them know as well. So I hope that you give them your undivided attention as you do. And I think that's it. Emma, who's introducing the team? Hi, welcome.
Hi, it's nice to see you all. My name is Emma. I'm a media specialist with Starting Over, and we've brought two Riverside University public health experts, Danielle and Kevin, who have created a really great presentation on COVID treatments, vaccination, long COVID info, and a bunch of resources available right here in Riverside, and they'll be available to answer all your questions at the end.
Hi, good morning, everybody. My name is Danielle. I'm here with Riverside County Public Health. I'm a program coordinator for the immunizations department, and I'm accompanied by Kevin. Kevin, did you want to introduce yourself?
Hi, good morning, everyone. My name is Kevin. I'm on RN with Riverside County Public Health Immunizations. I work with our mobile immunization team, so we provide COVID vaccinations out to our community. So excited to share information with you all and to answer any questions you may have.
Awesome. Thank you, Danielle and Kevin. I guess we can get right to it. These are some recorded slides, so please let me know if there's any issues with, if you can't see the slides or if you have any issues with the audio. Okay, let's go.
So we can't see the slides. Are you screen sharing right now, Emma?
Oh, you can't see the slides?
No.
Okay, let me stop and restart the sharing. Sorry about that.
Emma, just so you know, Emma is on our team. She works for actually me. She's in charge of our media and communications, all our social media, all of our campaigning. She makes us look good in print. She's talented. She was once one of our interns, and then she became our media and communications specialist. So, and then she's also taken the lead on this grant. So, hey, there's lots of opportunities to work with Starting Over. Like we mentioned, some people volunteer at first. It's like Janet G volunteered at first, and now she's part of the team. So just want you to know that. Yes, Emma, now we can see your screen.
Awesome. Okay, let me know if this audio is working.
Good morning, everyone. My name is Danielle Lee. I'm with Riverside County Public Health Immunizations Department, and I'm accompanied by Kevin, who is an RN who will answer any questions you might have that arise from this presentation. It is our pleasure to be here today to provide additional understanding about COVID-19, vaccinations, post-COVID, and COVID-19 treatment options. To provide a deeper understanding of the coronavirus, also referred to as COVID-19, coronaviruses are a type of virus with a crown of spike proteins sticking out, as referred to in this picture provided on the left of the screen. There are many types, including SARS, MERS, and viruses that cause colds. SARS-CoV-2 is the specific coronavirus that causes COVID-19. COVID-19 causes respiratory symptoms, but can also harm other parts of the body. Now let's discuss the COVID-19 vaccines. A few frequently asked questions we receive regarding the vaccine are, how do vaccines prevent illness? What are some reasons a person might get a COVID vaccine? How safe and effective are vaccines against COVID? COVID-19 vaccines help the body to develop immunity to the SARS-CoV-2 virus. They provide strong protection against serious illness, hospitalization, and death. Side effects are generally mild, and vaccines are very safe and effective. There are currently 2 COVID-19 mRNA vaccinations, which include Pfizer and Moderna. These mRNA vaccination enable cells to produce spike proteins using the instructions from the mRNA. Immune systems build antibodies to fight against the spike proteins. So in the event if a person is exposed to SARS-CoV-2 later, the immune system remembers the spike proteins and can quickly build antibodies against it. This flyer provides a deeper understanding on how mRNA COVID-19 vaccines work. Coronavirus, like the one that causes COVID-19, are named for the spike-like proteins on their surface called spike proteins. These spike proteins are ideal targets for vaccines, as seen in the provided picture. Messenger RNA, also referred to as mRNA, is the genetic material that tells the body how to make proteins. The vaccine is made up of mRNA wrapped in a coating that makes delivering easy and keeps the body from damaging it. This vaccine does not contain any virus, so it cannot give you COVID-19. It cannot change your DNA in any way. How does the vaccine work? The mRNA in the vaccine teaches the cells how to make copies of the spike proteins. If you are exposed to the real virus later, your body will recognize it and know how to fight it off. After the mRNA delivers the instructions, the cells break it down and they get rid of it. When your body responds to the vaccine, it sometimes causes symptoms like mild fever, headaches, or chills. This is completely normal and is a sign that the vaccine is working. COVID-19 protein subunit vaccinations. Vaccines from Noravax are a protein subunit vaccine that contains harmless copies of the COVID-19 spike protein. This vaccine is different than the mRNA vaccinations. The vaccine from Noravax contains an ingredient called adjuvant, which helps the immune system respond to the spike proteins. Immune systems build antibodies to fight against the spike proteins. If a person is exposed to SARS-CoV-2 later, the immune system remembers the spike proteins and can quickly build antibodies against it. No vaccine is 100% effective, but people who are up to date with their COVID-19 vaccine have a lower risk of severe illness. The attached flyer provides a deeper understanding of protein subunit COVID-19 vaccines and how they work. As previously discussed, coronavirus, like the one that causes COVID-19, is named by its crown-like spikes on their surface called spike proteins. These spike proteins are ideal targets for vaccines. What is a protein subunit vaccine? Protein subunit vaccines are a type of vaccine that cause harmless copies of the COVID-19 spike proteins. These vaccines do not contain the entire virus. The vaccine does not contain any live virus, so it cannot cause you to get COVID-19. What is in the vaccine? The vaccine contains virus pieces called spike proteins and another ingredient called adjuvant. How does it work? When you are vaccinated, nearby cells pick up the proteins. The immune system recognizes that the proteins do not belong. The adjuvant helps the immune system produce antibodies and activate the other immune cells to fight off future infections. Once vaccinated, our body recognizes the proteins should not be there. Antibodies will fight the virus that caused COVID-19. Again, when your body responds to a vaccine, it sometimes causes side effects such as fever, headaches, and chills, and these are completely normal and mean the vaccine is working. Vaccine recommendations for age group. Moderna and Pfizer's 2024-2025 COVID-19 vaccines are available for everyone ages 6 months and older. Noravac's 2024-2025 COVID-19 vaccine are available for everyone ages 12 years and older. Let's discuss post-COVID conditions, also referred to as long COVID. Long COVID is broadly defined as signs, symptoms, and conditions that continue or develop after initial COVID-19 infection. Symptoms are present 4 weeks after the initial phase of infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. Long COVID prevention measures include the COVID-19 vaccination, as well as oral antiviral treatment. Paxlovid has been linked to lower the likelihood of getting long COVID. There are many symptoms that develop from long COVID, but the most common symptoms include fatigue, headache, brain fog, depression, poor sleep, shortness of breath, and chest pain. Unfortunately, there are currently not any approved medications for long COVID, but healthcare providers can provide care to reduce symptoms of long COVID. For most people with long COVID, the goal of medical management is to optimize function and quality of life. COVID-19 treatments. COVID-19 treatments, also referred to as oral antivirals. What are oral antivirals? Oral antivirals are pills that stop the virus that cause COVID-19 from making copies of itself in your body. 2 oral antivirals are available. Paxlovid, which is for adults and children 12 years of age and older. Lagevrio is for adults 18 years and older. A few commonly asked questions regarding oral antivirals are, what is the time frame I should start taking oral antivirals? Both Paxlovid and Lagevrio should be started from the first day of symptom onset up to day 5 of symptom onset. How do you get an oral antiviral? Oral antivirals are available with a prescription from a healthcare provider, and Paxlovid may be prescribed by a state licensed pharmacist. Patient assistance programs for COVID-19 treatments are available. There are 2 patient assistance programs offered through Pfizer. There's a Pfizer co-payment savings program, which is for privately insured and commercially insured patients, where the payment can be as low as $0 for a co-payment savings program, but you must sign up for this. Additionally, the U.S. government patient assistance program called USG PAP, which is operated by Pfizer, is also available for patients who are uninsured and underinsured with public insurance are eligible to use this USG PAP operated by Pfizer to receive Paxlovid at no cost. Underinsured patients with high co-payments for Paxlovid and cannot afford the medication are eligible. Eligibility for uninsured and underinsured patients is also based on household income at or below 300% of federal poverty level. Lagevrio also offers 2 payment assistance programs, one being a co-payment savings program, which is for privately insured patients to save on their out-of-pocket cost for their prescription. Additionally, they offer a patient assistance programs for patients who are suffering financial hardship and would not be able to afford the medication otherwise. All of these patient assistance programs, including Paxlovid and Lagevrio, require applying for the program prior to getting the prescription. Let's discuss a few resources. RUHS Public Health has a few websites covering all of the information I have discussed today. The QR code on the left of the screen goes over any upcoming clinics that we have scheduled for the community. By scanning the QR code or by clicking on the attached link, it will take you to the website. When you scroll down to the bottom of the page, you'll be able to see the location and times of the clinics that we have available, along with the vaccines that we will be providing to the community. The QR code on the right of the screen goes over additional details surrounding post-COVID treatment options. You can either scan the QR code or click on the link provided for post-COVID treatment options. And last but not least, RUHS Public Health has a COVID-19 treatment options webpage that discusses the treatment options and available resources in greater detail. By scanning the QR code or clicking on the link provided will take you to the website and go over specific details surrounding COVID-19 treatment. On behalf of
Thank you so much, Danielle and Kevin. I was wondering if it would be okay if, before we get to questions, if we could turn it over to another member of the Starting Over team, Fidel, who's an organizer with Starting Over and Riverside All of Us or None, who came here today to share a bit about his own experience with COVID and a vaccination. Fidel, I will turn it over to you. Fidel, I think you might be muted.
Can you hear me?
Thanks. Yep.
Okay. Hello, everyone. Thank you, Emma, for introducing me. Yeah, my experiences with receiving the COVID-19 vaccination. At first, I was kind of skeptical about receiving it. But at the time, I was taking care of my father who was on dialysis. So I wanted to make sure that, he was safe because a lot of things were going on when it first started. A lot of people were being affected. And I was concerned. I was really concerned about it. And I was concerned about me bringing any kind of COVID symptoms to my father because of his health conditions. So I did get vaccinated. At the time, the process was a little bit, it was long because a lot of folks were trying to get vaccinated. Um, and I had to stand in a line. I had to wait. I had to provide documentation because I was working for in-home support services as well. And uh, and then I received the vaccine, uh, and I didn't feel I didn't feel no after effects or anything after I received it, and uh, and I didn't get sick. I didn't get COVID. And then I received the second one. Um, and my experiences were good. I just had my arm was sore a little bit, but that was really it. But I was really concerned about spreading it to my father, and that was one of the things that motivated me. Because what I was noticing around me is a lot of folks that were getting COVID, if they had health conditions, it was really affecting them really bad and making it difficult for them to uh to get better. And just knowing that, I wanted to protect my father and protect myself as well. But it started off with my father, so that way he wouldn't get sick, and I wouldn't bring it to my family members. And then in the process, I felt more comfortable with taking the vaccination because um, I didn't get sick. I didn't get sick, and and I was noticing that a lot of other folks were getting sick that didn't take the vaccination. So it worked good for me. There was no side effects. Um, like I mentioned, my arm was sore, and that was pretty much it.
Thank you so much for sharing that, Fidel. Yeah, so one thing we wanted to hit on is that to prevent, the spread of COVID and also the oftentimes like devastating effects it can have on our bodies and like our loved ones' immune systems. The best way is to mask up if you feel sick or if you're in like a very crowded area, to get vaccinated and to get tested if you don't feel well. We do have some rapid tests, masks and hand sanitizers available in the office, but like Fidel said, it's kind of like a communal effort to keep each other from getting sick because some people with weakened immune systems aren't able to get the COVID vaccine. So the people that are able to, it's good that they do because then they can prevent the transmission of the virus to more vulnerable people who would have more like risky time with COVID if they were to happen to get it. So thank you so much, Fidel. Now I will turn it back over to Danielle and Kevin if anyone has any questions about the COVID resources, long COVID treatment, or vaccinations.
Does anybody have questions? I have one question about availability. Hi, Tamara here. So previously you mentioned a lot about signing up with Pfizer and some of the other groups for the whatever it was. But my question is, most of our folks here are underinsured or on Medi-Cal. Is there a requirement for them to sign up, or when they go to the FQHC clinics or the community health clinics, does the community health clinic take care of that for them, or Kevin, you mentioned you do mobile clinics? Do my people have to worry about a copay and ability to pay because they currently either have Medi-Cal or no insurance? Please talk to us about the availability of the treatment in those cases.
Hi, I can I can speak on the the vaccines that we offer. So currently with RUHS, we offer COVID vaccines through the Bridge Access Program, also referred to as the BAP program. And what the qualifications are for that is it really helps those who have no insurance. So any patients who come to our clinics who have no insurance, we are able to provide that BAP funded COVID vaccine. Unfortunately, those who have Medi-Cal, we would have to refer them to one of our community health centers throughout Riverside County. They may have COVID vaccines available for those who have Medi-Cal or those who have private insurance. And those may be as well those who have insurance, but maybe they have a high copay. They would also qualify under the BAP program for COVID vaccinations.
Okay, because none of our folks have private insurance. They probably have the Medi-Cal or they don't have current insurance. So if I understand you correctly, Kevin, you would only be assisting if they didn't have Medi-Cal at your mobile clinics. But there are like I think 12 community health clinics throughout Riverside. There's Banning, there's Hemet, there's Paris. You know, they have the Moreno Valley, all of these spaces. So you can get the vaccine and they will sign you up. You don't have to worry about that. Is that what I understand to be the truth here?
That is correct. Yeah, we help those who have no insurance, and then our community health centers throughout the county, or even some local pharmacies may be able to provide to patients with Medi-Cal.
Oh, local pharmacies too. But by show of hands, how many of you have ever thought you had COVID before? How many of you ever thought that you've had COVID before? And for those of you who didn't raise your hand, how many of you never tested for COVID before, so you don't know if you've had COVID? Have you ever tested and not had it? Okay, you've had it, you didn't feel the symptoms. So your presentation, Danielle and Kevin, it didn't really talk about symptoms. You talked about prevention a lot. But is it true that people could have COVID without having symptoms?
That is true. That is true. Some patients might, have the infection, but they might not show any symptoms until they actually get tested for COVID. So oftentimes, if let's say you have a family member who may be sick and tested positive for COVID and you've been kind of around them, you may have been infected and may not show symptoms, but if you do decide to take a test because you might notice, oh, my family member have tested positive for COVID, there's a chance that when you take a COVID test, you did get infected and you come up positive, but you may have no symptoms, but let's say your family member might have gotten some symptoms. So yeah, it could be possible to show no symptoms of COVID-19. So that's why we kind of stress the importance of, assessing your own risk factors, your own risk if you want to wear a mask if you're out in public, or taking that COVID vaccine to help protect and build your immunity to it.
Okay, thank you.
Mhm.
I have another question as it relates to work, and I'm not sure if you guys can answer this, but under the current guidance, is there current guidelines as it relates to when a person should return to a workplace? This is a employment training class, right? So we're talking about worker rights and protections. Under the current guidelines, is there protocol for when a person should return to work, or can they return to work if they feel fine and just mask up? What is the current protocol? Because I know we had a lot of protocol at first, and now, I'm not sure if it's not without a fever. Can someone speak to that, or do you have that information?
I can speak to that. Basically, it's based off of the job criteria. So we have in the county, we have job criterias as far as when people are able to return to work. Excuse me. So we can forward that information over to you. It's posted on our website, but we can share that information with you based off the job criteria.
Okay, so based on what job you do, you can send it. There's criteria, but one of the main things is if you're feverish, if you have a fever, stay home, right? And then she'll send it to you too. It's about isolation. They want you to isolate. So isolation could be a lot of things. If I have my own office and my own space, I'm not around someone 6 feet. Look, people are going to work with people that are not. But they're going to send us criteria because are you infecting other people? So that's the other thing, right? The communal spread. You can't get paid for having COVID still, but we talked about worker rights, where after 90 days you have sick time. So in order to prevent that kind of thing, is the COVID vaccine, does that look at work? If you want to stay on a job, especially when you're first starting a job with no 90 days, the COVID vaccine should look attractive, particularly if you've been behind the walls for a while. Now you're out into the community. So community spread you could be susceptible because you're not used to being outside of that environment. So now you're going in an environment in a warehouse where there's a lot of people, or wherever you're going, right? So it could be, yes, did you have a question?
Even though I was quarantined 5 times, positive 5 times. Is this COVID still in my system? And when I'm tested, will it show that I'm positive for it?
How long ago was that?
Just this last year,
Oh,
24.
he wants to know about, does COVID stay in your system even after you've had it? Can someone speak to that?
For COVID, typically, there's the isolation and quarantine period. It's usually up to 10 days. They recommend, if you test positive or have symptoms, to isolate until your symptoms get better. Or if your symptoms get better or you're asymptomatic, then it's about 5 to 10 days. Typically, you should clear it out. But there have been some cases, especially during the early days, where patients would continue to test positive, even though because it might the test might pick up really small amounts of the viral the virus. So it can also depend on your workplace and their protocols if they require you to test before you return. A lot of times it's as long as your symptoms are okay and you've passed your isolation period, then you're okay to return to work. There's no need to retest. But again, it can also depend on your workplace because there may be some workplaces that require you to retest. but it could just depend. But typically, your body should clear out the infection.
Does that answer your question?
Yeah.
Okay. Does anybody else have any other questions? So this is good to know. We look forward to getting information about the current guidelines because our men and women are trying to go back to work. They want to keep their bodies safe, but also, you know, understanding how the vaccine can protect them. Being in new spaces, you know, might be something for them to consider, even if you're anti-vaccinist. A lot of people are anti-vaccinist, and that's your right and your privilege. But understanding how this virus can affect your workplace, that your ability to keep a job, those kinds of things is important. And then you make your judgment, you make your decision, right? They also mentioned that there's also oral treatments. Did they talk about that? So you don't also have to be like getting the vaccination. And they also dispelled some myths, right? They dispelled the myth. No, you're not getting COVID injected into you. They're getting something that's injected into you to make the proteins that combat COVID, you know, stronger. So we have a myth that, oh, we get the vaccination, you're shooting the live, you know, disease into me. That's not what this is. So this is why this is important to get educated on this stuff. Today you might not want a vaccine, tomorrow you might. So at least you understand a little bit more about it, and you can also reach out to our friends at Riverside University Health System to get more information. How's that sound? One more thing, John? How long does the vaccination last? How long does the vaccination last? That's a good question.
Are boosters required?
That is a good question, and I'm glad you brought it up. So you know, before when the COVID vaccines came out, they're recommending for the mRNA vaccines that we had discussed, you know, it was 2 doses. So most people, you know, they say, okay, I received my 2 doses, I'm good. Or, you know, I received my booster, I'm good. But we're kind of trying to move away from just how many, the idea of, you know, the number of COVID vaccines that you receive, where it's going towards the direction of like the seasonal flu shot. So, you know, if you receive your flu shot every year, it's the same idea. Um, the flu virus can mutate. There might be a new strain that's going around for that flu season. And so, you know, a new vaccine comes out and you get it every year around, you know, between September to March. We're heading the same direction for the COVID vaccine. So we're no longer looking at, I got this many doses, or I need a booster, do I not need a booster? It's going to be a yearly annual thing. So currently, right now, we have COVID vaccines with a 2024-2025 formulation that helps to protect you against the current strain of the virus that's going around and making people sick. And so I was looking at the data from the state, and only about 13% of the state is actually up to date on their vaccine. So we're really trying to go out to the community and have you know, recommend that patients get the most up-to-date COVID vaccine so that they are up to date and have the best protection. And so come next year in the fall again, they will be updating the formula to then target the strain that's going around. So in short, it's going to be a seasonal thing, annual thing, just like the flu shot.
Does that answer your question?
Yeah.
Okay, anybody else? Well, you know, thank you, Riverside University Health System. Thank you, Emma, for bringing this important topic to our folks. Look forward to you guys coming back. If things change, keep us informed so that we can, you know, maintain our health and wellness, right?
Tamara,
Thank
can
you.
I add one more thing really quick?
Of course, go ahead.
Regarding the Paxlovid and the antiviral treatments you had mentioned or asked about, if somebody does test positive, they can go into the community health centers and the doctor will prescribe an antiviral if it's necessary. If it is provided, they'll provide you with the prescription and they will assist you with getting that prescription refilled at the community health centers. So it should be provided at no cost to you.
Well, I love that. Did you hear that? The anti-vaccine folks, oral, that's the thing, the medication is available at no cost. So for those of you who don't want it, you're not, you don't believe in it, or for whatever reason, you could be compromised immune systems, what have you. Then the oral treatment, the prescription is available to you and it's covered by your Medi-Cal or what have you, and it can be, you can receive it by either by a pharmacist or through Riverside University Health Systems clinic, many clinics that we have here in our county. That's really helpful information, right? Because, people take the flu vaccines, they're taking this vaccine, so maybe that might be a better entry point into staying well. So thank you so much for that information.
Thank you so much, Danielle and Kevin and Fidel, for sharing. And thank you to our Path to Seed class for receiving all this information with open minds. Again, we do have supplies like COVID tests, masks. We also have child masks available and hand sanitizer available at the office. And we also have some COVID information flyers if anyone is interested in picking those up. And we'll also be compiling some of these resources and also a recording to the webinar on our website in the next couple of weeks. So stay tuned. And thank you again for all of your participation and time. It's been a pleasure seeing you all. Thank you so much, everyone.
Bye, Emma. Thank you.
Thank you.
Thank you.
Thank you guys. That was awesome.
Thank you. Have a good one.
Have a good one. See you in like a week.
All right. Thank you.
Thank you.